Anxiety can be exhausting, mentally, emotionally, even physically. And for many people, using drugs or alcohol starts as a way to calm the constant worry. But over time, that short-term relief turns into a long-term problem. Hi, I'm Jacob Christenson, CEO of Radix Recovery in Cedar Rapids, Iowa. And if you or someone you love is struggling with both anxiety and addiction, I want you to know this: you are not alone, and healing is absolutely possible. It's more common than you might think. Anxiety disorders are the most frequently diagnosed mental health condition in the country. And many people turn to substances to cope. Whether it's alcohol to relax after work, a pill to take the edge off social situations, or drugs to escape panic attacks, the cycle is the same. Anxiety leads to substance use. Substance use worsens anxiety over time, and eventually both become hard to manage on your own. That's what we call a co-occurring disorder, and it's why we provide specialized, integrated care for people facing both challenges at once. If you're unsure whether anxiety and addiction are both playing a role in your life, here are a few signs to look for. You use substances to relax, sleep, or calm your nerves. You feel anxious, relentless, or panicked when not using. Your substance use worsens anxiety symptoms over time. You've tried to quit before, but anxiety made it feel impossible. You avoid situations that trigger fear and lean on substances to get through them. If this sounds familiar, you're not weak, you're human. And with the right support, there is a way out. At Radix Recovery, we don't treat addiction in isolation. We look at the full picture, and that includes the emotional and psychological side of recovery. Our dual diagnosis program is built to help you heal from both anxiety and substance use at the same time, using a personalized, evidence-based approach that includes cognitive behavioral therapy to break thought loops that cause anxious spirals and fuel addiction, dialectical behavior therapy to build emotional regulation and distress tolerance, mindfulness and grounding exercises to calm the nervous system and stay present, and relapse prevention planning to help you manage anxiety without turning back to substances. You'll also have access to group therapy and individual counseling, where you'll build practical skills, talk openly about your experience, and learn how to live a life that's full without fear holding you back. Trying to treat addiction without addressing anxiety is like putting a bandage on a broken bone. It may cover it up, but it's not going to heal. We've worked with people who have struggled for years because no one ever treated both conditions together. But when we do, everything changes. Sleep improves, panic fades, confidence grows, and the need for substances starts to disappear because you've finally learned how to cope in healthy ways. Anxiety is a survival instinct that's gone into overdrive. Addiction is a response to pain. Neither makes you weak, and both can be treated. At Radix Recovery, we meet you with compassion, not judgment. We walk with you step by step through the anxiety and through the cravings, so you can build a life that's not ruled by fear or addiction. If you're tired of living in constant worry and tired of using substances to manage it, we're ready to help. Call Radix Recovery today to schedule a free assessment. We'll walk through your experience, help you understand what's really going on, and build a plan for your healing. There is freedom beyond fear, and your recovery starts here.